The Charter of Rights really sets out for duty bearers the responsibilities they have to make sure that people are not discriminated. For health and social care, it's very explicit that that duty is to make sure that it isn't discrimination against people using health and social care services. And that discrimination isn't just direct discrimination, it's where that indirect discrimination shows up. So when we think about as a duty bearer, as a provider of health and social care services from acute hospitals, primary care or services that have been commissioned by the health and social care authorities, that those services have really meaningfully understood what it's like to try and access those services if you have a substance use, and how your outcomes, how your quality of life is as equally achieved as somebody who's not affected by substance use. At Healthcare Improvement Scotland, we both have a responsibility in writing standards, but also ensuring that standards are upheld. By recognising the Charter of Rights at Healthcare Improvement Scotland through our work, both in working with partners in how services are improved and how services are transformed, but also as part of our role in inspecting services and working with hospitals and teams, and as we engage with individuals using those services, really understanding if their rights as set out in the Charter are being met.
So at Audit Scotland, we found the Charter really quite helpful. It was actually still been, we were carrying out an audit looking at alcohol and drug services, a performance audit during 2024. We actually published the audit before the Charter was finalised, but because I've been involved in quite a lot of discussions and, as part of the duty bearers panel, I was able to draw on, kind of what was being discussed and how the Charter was developing to help feed into the audit and think about, the pertinent things that we were looking at. And I think it was because the way the Charter's been developed, national collaborative, and a lot of the people involved have lived experience as well, was really helpful. It helped to make us think about why it's important, what things are important to people that are using alcohol and drug services or are affected by it. So I think it did kind of really help us think about how to focus some of the audit and the audit questions.
We've been involved in developing the Charter of Rights as one of the stakeholders, as part of the change team, but also as a duty bearer in the duty bearers group for the Charter of Rights. It's something that as an organisation we believe passionately that it's really important that people with drug and alcohol issues have their rights upheld. As part of our inspections, we speak to people and carers about how they feel they're treated, how their satisfaction with the services, and just their experiences of using drug and alcohol services. And it's one of the panel principles of the Charter, about participation. So in speaking to people, we're upholding their rights, but we're also asking them, do they feel that their rights are upheld by the service? So that's just one way we would be implementing the Charter as well as an organisation. We also have embedded in our training system, which we call LMS, and it's the learning and development for inspectors, but we've added sections on the Charter of Rights and on drugs and alcohol, and that's just something that will be available to all inspectors going forward.
For us, around the future of the Charter and using it, it's we've carried out an audit already, looking specifically at alcohol and drug services. Not sure if we'll have something coming up in the near future, looking at that again, but we do ongoing monitoring and look at impact of our reports. So it's something that we'll be doing over the next year, is kind of looking at if our recommendations from our report have been implemented, and kind of what improvements have been made around the services. It'll be fairly high level, but again, that's something that we can kind of use the Charter to kind of, or the toolkit to, as a bit of a checklist or, reminder about kind of what things are important.
At Healthcare Improvement Scotland, we have the responsibility to assure the health and social care system, to make sure that services are being delivered to the standard that we expect in Scotland. And that will include working with our assurance colleagues and our inspections teams so they really understand, as they're carrying out their duties, to look at quality and safety of our health and social care system. that people who are affected by substance use, are they having their standards and rights met? What does that look like, and what recommendations would we be giving to health and social care organisations in Scotland to make sure that they're adhering to the Charter of Rights for the population?
My view in life has always been that we're all equal, that we all deserve to be treated as we would like to be treated. And it doesn't matter if you're someone who uses drugs and alcohol, or if you're someone who used to use drugs and alcohol, or if you're the relative of. I think we're all touched by drugs and alcohol in our society in Scotland. So I just think that the Charter is something that puts it in writing, it states the rights of people who use drugs and alcohol, and they should be given those rights, just like we all expect our own rights to be upheld.